Recurrent abdominal pain, your RAP, means child complaining of recurrent abdominal pain, not fitting with the any definite diagnosis, any definite abdominal diagnosis like acute helminthitis, urinary tract infection, or peptic ulcer disease, cholecystitis, and your appendicitis, cholangitis, and hepatitis, not meeting with any definite diagnosis or any surgical condition. You have the entity which you call recurrent abdominal pain syndrome, RAP. It is mostly your functional, your psychological mostly, and your at times the symptoms are quite sufficiently severe. They are causing the activity and the normal activity of the child and the family impaired, and this and most important, before labeling the RAP or the recurrent abdominal pain syndrome, one must be sure that this he or the not fit missing any organic diagnosis, which I said earlier, and it is more common in 5 to 15 years old child, and the child is otherwise healthy. There is no definite objective physical finding on examination, and investigation also doesn't reveal anything. So you do not need to investigate, be clinical in diagnosis of any organic diseases, and it's important. And the symptoms of this abdominal pain, they last for few minutes to 1 hour, not more than 3 hours. And there remains, this is, as I said earlier, it is a functional disorder. So there remains anxiety, depression, and your other somatization, sleep disorders. These children that do not sleep well, that do not defecate in proper time, so that they have functional constipation very often, and their parents has also similar sort of problem in their early life. And so you see, so in abdominal pain is your recurrent abdominal pain, 10% only are organic, 90% functional, psychological, whatever you call it. And then and then how to investigate? Most of the time, it is mostly clinical diagnosis. Most of the time, you do not need any investigation. But at times, when you are not certain about the exclusion of the organic disease, you do investigate little bit the said diagnosis, as I said earlier. And when you are certain it is your functional recurrent abdominal pain syndrome, then you go for treating and talk to the parents in counsel the child and counsel the parents, and then go and then give amitriptyline, 10 milligram at bedtime, maybe up to 25 milligram, pyridoxine 0.5 milligram at bedtime, and make sure that your child slept well, his bowel is moved, and your his attention is being diverted to normal activity. So at one time, at one stage of your disease, you will forget the symptoms. You will not talk about this. It may take months, even years together, and observe any danger sign. Otherwise, you will have the eventual recovery.